Terrorism. Preparing for a terrorist bombing. A common sense approach. Although terrorists use a variety of methods to inflict harm and create fear, bombs are used. According to the U.S. Federal Bureau of Investigation, bombings accounted for nearly 70% of all terrorist attacks in the U.S. and its territories between 1980 and 2001. This document focuses on common sense principles that will be useful in a bombing event. What can I do now? The CDC and the American Red Cross encourage every organization, family, and individual to take time to prepare for an emergency or disaster. These steps can help you get started. Know your work, school, and community disaster plans. If you are not familiar with the plans, contact your supervisor, school administrators, or your local fire department for information. Identify an alternative hospital. Hospitals closest to the event are always the busiest. What should I do if I think someone is going to set off a bomb? If you are at home or in public, leave the area immediately. Call 911. Tell the operator what you saw or know. Suspicious persons, packages, or vehicles. Follow directions from the people in authority. Police, fire, EMS, or military personnel, or from neighborhood and community leaders. If you are at work or at school, follow existing evacuation guidelines. Follow directions from people in authority, police, fire, EMS, or military personnel, or from workplace supervisors or school administrators. What should I do during a terrorist bombing? If you are in a bombing event, leave the area immediately. Avoid crowds. Crowds of people may be targeted for a second attack. Avoid unattended cars and trucks. Unattended cars and trucks may contain explosives. Stay away from damaged buildings to avoid falling glass and bricks. Move at least 10 blocks or 200 yards away from damaged buildings. Follow directions from people in authority, police, fire, EMS, or military personnel, or from school or workplace supervisors. Call 911 once you are in a safe area, but only if police, fire, or EMS has not arrived. Help others who are hurt or need assistance to leave the area if you are able. If you see someone who is seriously injured, seek help. Do not try to manage the situation alone. What should I do after the bombing? When the explosion is over, follow your family, job, or school emergency disaster plan for leaving and staying away from the scene of the event. Remember, returning to the scene will increase the risk of danger for rescue workers and you. Avoid crowds. Crowds of people may be targeted for a second attack. Avoid unattended cars and trucks. Unattended cars and trucks may contain explosives. Stay away from damaged buildings to avoid falling glass and bricks. Move at least 10 blocks or 200 yards away from damaged buildings. Follow directions from people in authority. Police, fire, EMS, or military personnel, or from school or workplace supervisors. Call 911 once you are in a safe area, but only if police, fire, or EMS has not arrived to help injured people. Help others who are hurt or need assistance to leave the area, if you are able. If you see someone who is seriously injured, seek help. Do not try to manage the situation alone. Listen to your radio or television for news and instructions. What if rescue workers are not available to transport me or other injured persons? 911 services, police, fire, EMS, and ambulance might be delayed indefinitely following a terrorist event. Therefore, always have a backup plan for transportation. Follow advice from your local public safety offices, local health department, local emergency management offices, fire and police departments, and reliable news sources. When should I go to the hospital or clinic? Seek medical attention if you have any of the following problems: excessive bleeding, trouble breathing, persistent cough, trouble walking or using an arm or leg, stomach, back, or chest pains, headache, blurred vision or burning eyes, dry mouth, vomiting or diarrhea, rash or burning skin, hearing problems, injuries that increase in pain, redness or swelling, injuries that do not improve after 24 to 48 hours. Help others who are hurt or need assistance to leave the area, if you are able. If you see someone who is seriously injured, seek help. Do not try to manage the situation alone. Where should I go for care? Go to a hospital or clinic away from the event if you can. Most victims will go to the nearest hospital. Hospitals away from the event will be less busy. What can I expect at the hospital? Long waits. To avoid long waits, choose a hospital farther away from the event. While this might increase your travel time, you might receive care sooner. Triage. Following a terrorist attack or other disasters, injuries are generally treated on a worst first basis, called triage. Triage is not first come, first served. If your injuries are not immediately life-threatening, others might be treated before you. The goal of triage is to save as many lives as possible. Limited information. In a large-scale emergency, such as a terrorist attack, police, fire, EMS, and even hospitals and clinics cannot track every individual by name. Keep in mind that it may be difficult for hospitals to provide information about loved ones following a terrorist attack. Be patient as you seek information. Mass casualties and injuries from terrorism. CDC's Emergency Preparedness and Response website at http:// emergency dot cdc dot gov. Chemical attack. Signs of a chemical attack would include many people suffering from watery eyes, choking, and having trouble breathing, and many sick or dead birds, fish, or small animals. If you suspect a chemical attack has occurred, avoid the contaminated area. Get away from the area or shelter in place, using the option that minimizes your exposure to the chemical. Wash with soap and water immediately if you were exposed to a chemical. Seek medical attention. Notify local law enforcement or health authorities. Biological attack. A biological attack may not be immediately obvious. Patterns of unusual illness or surge of sick people seeking medical treatment may be the first sign of an attack. If you believe there has been a suspicious release of biological substances, quickly get away from the area. Cover your mouth and nose with layers of fabric, such as a t-shirt or towel. Wash with soap and water. Contact local law enforcement or health authorities. The CDC has listed the following agents as Category A agents, meaning they pose the greatest potential public health threat. Anthrax, botulism, plague, smallpox, tularemia, viral hemorrhagic fevers.